Hello, my name is Maya Delgado, and for this project, I chose to talk about equine metabolic disorders. So, how do diets affect equestrian metabolic disorders? This will be my main focal point, my main topic question. A horse's diet is one of the most crucial aspects in managing the metabolic process, as well as their overall health. Without a proper diet that's kind of specified to their unique needs, a horse may easily develop metabolic disorders. The two metabolic disorders that I'm going to be talking about in these slides are equine metabolic syndrome, also known as EMS, as well as polysaccharide storage myopathy, also known as PSSM. These disorders may be life-threatening and they require proper management for the sake of the horse survival. The most efficient way found to prevent and or manage these disorders is through a nutritious diet specialized to their needs or what they need in the current time of their stage of their health. So metabolism is the process in which consumed substances are biochemically converted into energy. This process is vital for life. The metabolic process converts these substances into energy by combining calories with oxygen, and that newly formed energy will be used for movement, growth, reproducing, and so much more. One example of this is protein being consumed will be broken down into amino acids. Those amino acids will then break down more food, and then it will grow and repair muscle tissue, body tissue. So if these substances are not being broken down properly, then it will affect the growth of body tissue and breaking down more foods. So that's exactly what a metabolic disorder is. It causes consumed substances to not be broken down properly, and then that negatively alters the distribution of nutrients, fats, and carbohydrates. So it kind of causes a domino effect. Although metabolic disorders are most commonly acquired, they may also be inherited through genetics of the horse. And the most common treatment for metabolic disorders are diet changes, such as reducing carbohydrates. So, Equine metabolic syndrome, it is a disorder relating to insulin dysregulation where blood insulin levels are out of the normal range. This causes horses to have a reduced ability to lose weight, and this also increases fat being held mainly in the neck area, it has been shown. So with this syndrome, carbohydrate spikes the blood sugar or blood insulin levels higher than it should, and it causes the return to the baseline levels slower than what it should. So as you can see here in this flow chart, the green squiggle line, that is normal blood sugar levels, and the purple line, it is showing how it would look for a horse with EMS. It shows a major spike and then a major crash. So how can a diet prevent or manage EMS? You can go about this through non-structural carbohydrate restriction. These are also known as NSCs. You can also eliminate pasture access or reduce their calorie intake. Exercise is also highly recommended. So to reduce grazing or pasture intake, you can use a muzzle. You should also reduce their calorie intake by reducing it to 1 to 1.5% of their current body weight for at least 3 to 6 months every single day. So an example of this would be feeding a 1,800-pound horse anywhere from 18 to 27 pounds a day in feed. You also should provide a hay that is low in these non-structural carbohydrates, or you can also soak the hay in water to remove excess sugars, and this will reduce glycemic and insulinic responses. So it will slow down those insulin spikes. Weigh bridges and weigh tape is also highly recommended to accurately measure and track the horse's progress so then you can go from there and decide what the horse will need. So the three major grass hays that are recommended for horses with EMS are mature grass hay, Timothy grass hay, and ryegrass hay. These are recommended to maintain blood sugar levels and insulin spikes for horses with EMS. Although ryegrass is recommended for horses with EMS, it is also highly debated against, which I thought was interesting. It has high levels of silica, and that may cause digestive issues. It has a lack of nutrition. It also may expose the horse to dangerous mycotoxins. This occurs from the molding of hay. I have found that the most recommended grass hay for horses with EMS is Timothy hay. It has high fiber, low sugar, and low protein content. It has a high nutritional value, and it also has digestive aids present to help the horse. So some symptoms of EMS would be continuous short strides, obesity, fat deposits, like I said, on the neck, that's where it's most commonly found. This is also called a cresty neck, a body condition score over 6 and under 9, difficulty breeding. So also affected horses are at high risk or more prone to laminitis. This is a disease that affects the horse's hoofs. So signs of EMS that has led to laminitis will be noticeable rings around the hoofs, pain, discomfort, lack of mobility or lack of walking, increased hoof temperature, and you may also feel the horse's pulse to the touch of their hoof. Laminitis can be fatal. It's extremely dangerous and it requires immediate medical attention. So I've put some example pictures in the first top two pictures. You can see some hooves of a healthy horse, and then in the right picture you can see hooves from a horse who has laminitis, and you could see those obvious clear rings around the hoof. And in the bottom two pictures, these will be the cresty neck examples. So in the first picture, you can see a strong, obvious, clear taper on the horse's neck. And on the picture on the right, the neck of this horse is just very wide. It doesn't really have as much of a taper as the other horse does. So this is an example of the cresty neck or the fat deposits on a neck of a horse. More about EMS, the main causes are excessive consumption of carbs and or lack of exercise. Some horses are more susceptible due to their genetics. Fat loss and building muscle naturally combats insulin resistance. This is because muscle tissue contains more insulin receptors than fat. Fat loss and diet changes need to change gradually. You cannot do it overnight, or it may cause more issues to arise. Diagnosis occur through glucose and insulin concentration measurements. This can be done through blood samples, oral glucose tests, or dynamic testing. And in a scenario with a thin horse that's diagnosed with EMS, calories should be consumed from roughage, fat, or protein supplements. This is because you do not want the horse to continue losing weight. Omega-3 fatty acids also improve insulin sensitivity, so this would improve those spikes and crashes that we saw in the previous slide. So now moving on to polysaccharide storage myopathy, also known as PSSM. This is a metabolic muscle disease in horses that leads to an abnormal accumulation of glycogen, also known as sugar, in muscles. This disease makes them more prone to injury and fatigue. There are also two types of this disease. The first type is caused from a genetic mutation, and that would be called glycogen synthase 1 gene. And type 2 involves an abnormal glycogen storage, but it's not associated with that gene. And to this day, the cause for type 2 PSSM is unknown. So signs of PSSM are muscle tremors or tying up, lameness, walking with pain or difficulty, sweating, lack of movement, lack of energy, and behavioral issues, especially when saddling the horse up because it won't want to walk or run since it's painful for them. And in this picture below right here, you can see the horse is glistening. You can visibly see that there are sweat drips going down the horse's face. So excessive sweating is a sign of PSSM. And this is a video that I found, and it's a really good example for what tying up or what muscle tremors would look like in a horse. So you can see that this horse is just continuously kicking at the ground. And this is what tying up would look like. It could also be in any other leg. It doesn't necessarily have to be in this leg, but it would look something like this. So a fun fact about this disease is that warm blood and Arabian horses have the most reported diagnosis or cases of PSSM. It didn't go into why this is. I'm assuming that these two breeds of horses carry the gene and they just keep getting reproduced and passing it on through generations. So, prevention and management of PSSM, there's currently no cure for either of the types of this disease. There's no definite preventions considering they don't know the cause of PSSM2, and PSSM1 is inevitable since it is caused from genetics. Proper nutrition along with exercise usually reduces severe symptoms such as tying up or muscle tremors. Minimizing sugar and starch in the horse's diet aids in preventing the accumulation of sugar in the muscle tissue. And avoid breeding a horse diagnosed with PSSM1 because, again, it will be passed on to the future generations. And exercise will utilize glycogen effectively rather than storing it in the muscle, causing those muscle tremors or insulin spikes. So PSSM is diagnosed through either DNA tests from the hair or blood samples. So that would detect if the glycogen synthase 1 gene is present. And for type 2, there are two common muscle biopsy tests that are taken to diagnose type 2. So the first one would be needle biopsy technique. This is when they insert a thin, kind of hollowed out needle and they will take a sample. This occurs through the middle gluteal muscle. It is quick and easy, but it is not extremely accurate. And the second biopsy technique would be incisional or open biopsy technique. This is also taken out from the middle gluteal muscle and it is more accurate, but it takes several days for the horse to heal. In the meantime, the horse is unable to run or exercise. Um, so once they get this muscle sample, they will bring it to a microscope. They will examine the muscle tissue and reveal the presence of muscle damage and excessive glycogen. So this is an example or a demonstration of the needle biopsy technique. So you can see that there is a little hollowed out needle and it just takes a tiny sliver of the muscle and then they would then test that. And right here in this blue area is where they would take that from in the gluteal muscle, not to be confused with the hamstring back here. And this is an example of the incision or open biopsy technique. So as you can see, it does require plenty of stitches and it does look like a large incision. So this would definitely take either days or if not weeks for the horse to heal before it can really be active. So more about managing PSSM through a horse's diet. A low starch, low carb diet will limit the release of insulin and stimulation of glycogen synthesis. In other words, it will limit those insulin spikes and crashes. It will also, you should also avoid excessive hydrolyzed carbs. These directly increase insulin. So you can do this by choosing a low hydrolyzed carb hay. This is considered 12% or less. You can also soak the hay in water for at least 30 minutes because this will dissolve the excess sugars. You may use a slow feeder hay net. This slows down the horse's eating, which would also slow down the insulin release. You can also use a grazing muzzle if pasture access cannot be avoided. So the use of fat or fiber to meet caloric needs, even if the horse doesn't need to gain weight, the horse can undergo ketosis, which would use fat as the main energy source. And fat does not trigger insulin release. So this would help with those insulin spikes again. This can also be done through omega-3 fatty acids such as fish oil or flaxseed oils. Vitamin E and selenium have also been shown to improve symptoms because they're antioxidants and it supports muscle growth and recovery, and this will hence prevent tying up or muscle tremors, muscle contractions. So that is it. If you have any questions or comments, please let me know, and thank you.